Okay, welcome, Lipstick and Logic. Today we are talking about
Biohacking your skin.
what's biohacking?
Well, I mean, it's trending. It's basically biologically hacking yourself so that in some way you can reverse the signs of aging, not just of your skin, but of every organ in your body. And we're seeing a lot of that today. People injecting themselves with peptides, many which are not FDA approved, in an attempt to reverse some of the hallmarks of aging, which we cover a lot in many of our presentations, which came out in the journal called Cell. They've identified that there's about 16 different pathways to how our cells age. And if you can somehow hack one of those pathways or multiple pathways, then in theory, you should biologically be able to alter the physiologic state of that cell.
So we're calling it biohacking.
We're calling it biohacking.
You know, I'm giving a talk in Monaco next week on neuroaesthetic hacking.
Okay.
So
Well, it all is in the same, I mean, we're one organism, right? The skin, if you're able to biologically from within impact the skin, then you're probably, the other organs in your body are probably reflecting that biological
But hacking
age.
is not a scientific term.
It's definitely not a scientific term.
just a way of taking advantage of the system that's in place, learning how to kind of manipulate the system to your advantage or the patient's advantage.
Mhm.
Okay, so
What do you know about that? Manipulating the system.
working within the system.
Okay, within the ground, within the framework.
Within the framework. All right, let's do a lipstick check.
Okay,
So
how does my lipstick look?
looks perfect.
Okay.
What's new in your world?
Lots. I just did a Take 10 laser procedure exactly 1 month ago. That's where we combine a series of 5 different lasers at our practice to basically, essentially, reverse the signs of aging where you visually might look up to 10 years younger.
And you
Can
are
you
looking
tell?
you are looking much younger. But you video logged this whole thing. So I know that people saw you and your social media posts as you posted every single day.
Well, if we're talking about biohacking the skin, that is one of the best ways to do it, right? I get a lot of people that say, if I do this, am I gonna, thin my skin? No, that hasn't been shown. In fact, it thickens your skin because your skin gets thinner with age because of its inability to produce new collagen, which is responsible for thickening it. And there's probably no other energy-based device that will trigger as much of a response than a CO2.
CO2 fractionated laser.
No, fully ablative.
Fully ablative.
Combined with the fully ablative erbium.
Which means you removed your whole superficial layers of skin. Your epidermis, part of your dermis.
Right. And so here, if we're kind of applying these concepts of biohacking, there's this concept of hormesis, right? If you create a certain level of stress, but it has to be controlled stress, like not too much stress on the skin could potentially age it or scar it, but just the right amount, just like with anything in life, right?
So do you create hormesis with me?
That's the goal. I've written the manual.
Just enough stress.
Just enough stress to keep somebody engaged. No, I'm just joking. But just enough stress to basically trick the body to be able to regenerate and create and lay down the amount of collagen, elastin, hyaluronic acid that it once did, but that has slowed down as a function of age. So if we look at those hallmarks of aging, we know that epigenetic changes happen with age, and CO2 laser resurfacing in a clinical trial.
So epigenetic changes, so for people who don't know what that means.
Well, you've written on it. So
I have written on it.
Yeah, so why don't you share what that means?
Well, there are modifications in the DNA that allows the DNA to be read differently, and subsequently the RNA and the proteins that are produced. And those epigenetic changes are modifications that can happen in a very short period of time. So you can make epigenetic changes to your DNA, which then can influence the proteins that come out. But then those epigenetic changes can pass on to your offspring. So Mateo may have some of those epigenetic changes.
And so on that, if we're talking about that, as we age, we have these epigenetic modifications that might accelerate cellular, death, or that might not allow a cell to function like it should.
Or the opposite.
And so in one study, a CO2 laser resurfacing procedure was able to modify the cells on the skin to behave like a more youthful state. So you can have a more youthful modification of your DNA for it to perform better.
So you're reversing aging?
So then you're essentially reversing aging. And so then
That's
that
really interesting,
gets
isn't it?
us to what we're here to talk about.
Biohacking.
Biohacking. So we have these epigenetic modifications. We talk about biohacking. And in fact, in one singular time point, if these things are tested, it may show a reversal of whether it's cellular senescence, that means the zombie-like cells in your tissue are being cleared, or these epigenetic modifications happen and it favors a more youthful DNA state. But the question then becomes, how long does that change happen for? And that's where the limitation lies in all of the procedures that we're doing, because we just don't know how long that hack is essentially good for.
So is this bioregeneration in your, as the way that some people describe it?
Well, that's a more medical term to be able to describe what we're doing. We're regenerating an aesthetic. We've published on this. Regenerative aesthetics is regenerating both the form and the function of how the cell should behave, whether it's that of the epidermis, top layer of the skin, dermis cells, second layer of the skin, fat, third layer of the skin, muscle, bone. We're restoring it back to a more youthful state.
So how do we make skin more youthful? How do we regenerate skin? How do we hack it? You talk about lasers as one way. Are there
so
other
lasers
ways?
are one way. So there's if you kind of use that paper from Cell to guide you, the 16 different pathways. We've shown CO2s have shown to be able to epigenetically modify to a more youthful state. Great. I just came out a month ago, that using a lighter laser, so it's not like you have to torch your face off, you can do a very light laser, like a clear and brilliant Permea, and couple it with, actually in this study,
It's a diode laser.
It's a diode laser with a CNE ferulic by SkinCeuticals, and we were able to show that it reversed signs of cellular senescence. What's cellular senescence? That's when your cells become kind of sleepy and stay in this zombie-like state. And so they're no longer functioning like they should. It's almost like Balboa Park at like 7 p.m. But anyway, it's like a zombie-like state. And so they're just kind of moving around, but they're not really producing and doing what they should. And so we saw increased activity, proliferation of your normal cells, and a decrease in inflammation from just doing 2 clear and brilliants 1 month later. So even a light laser has been shown to at least address one of those pathways. And so you can do it with lasers, but you can also do it with injectables.
So injectables, when you say injectables, you're talking about hyaluronics, you're talking about PLA, you're talking about calcium hydroxyapatite. How do you reverse aging with fillers?
That one paper that came out in 2018 that you and I always cite, which was very insightful, and it showed that injectables may be actually getting their volumetric improvement, not just from the gel implanting and basically displacing tissue and drawing in water, but because of the stimulation of these gels, whether it's hyaluronic acid, calcium hydroxyapatite, or even PLLA, on the adipocyte-derived stem cells. These are stem cells that reside at the very top layer of your fat, the junction between your skin and your fat. And they are these what we call progenitor cells that can go on to differentiate into the cells that create collagen and elastin, or the cells that create young, youthful fat. And so that's why there's a greater impact or longevity after you inject these gels. Why does someone maybe still look good a year later, or 2 years later, or 3 years later? It's because of the stimulation on those stem cells, which is another hallmark of aging, which is stem cell exhaustion.
So the stem cells are really interesting to us, because I know you and I wrote a paper in 2022, I believe it was, about how GLPs may actually inhibit the adipose-derived stem cells, or those progenitor cells, that then go on to create youthful collagen and elastin. So that might be the key,
right,
to making skin look more youthful, are those adipose-derived stem cells. Now, when I do fat transfer, I actually transfer adipose-derived stem cells. I take it from somewhere else in your body and I put it into the superficial layers of the skin near the level of the dermis, probably giving people that benefit. And that's one of the reasons why after fat transfer, skin looks so fantastic. But if you can give someone really youthful adipose-derived stem cells, that might be even better.
Right, if you can trigger their stem cells to continue to work. And so we were one of the first to actually show So then again, the question becomes, you inject this stuff. It's been shown to do it, but how long does it continue for after you have hacked it? That's where all of these, there is definitely a regenerative potential for many of the things that we do. I fundamentally believe that some of the things that we do just do it for longer than others. So it's not that they don't work. I think all of it works to a degree, as with everything in life. I think that just some are more effective at creating that stimulation for longer, whether it's an epigenetic modification, whether it's clearing cellular senescence, whether it's improving intracellular signaling, whether it's decreasing chronic inflammation, whether it's stimulating stem cells. All of those different parts of the cell cycle have been improved by the things that we do in aesthetics. But with the adipocyte-derived stem cells specifically, I think that PLLA, at least what we showed in our trial, was that after just 3 sessions, 6 months after the last session, there was still a doubling in the population of stem cells in that tissue. So we're just at the beginning of what those stem cells are doing there, right? So there's probably, some of these products probably just do it for longer.
And so when you did your studies, you took tissue biopsies after injecting PLLA.
So we did it before we injected on a population that wasn't on GLPs, mind you, because we're doing a different study with that now. And then we did biopsies 6 months after their last injection. So they did 3 injections 1 month apart.
And what markers are you looking for?
So there are various biomarkers, tissue markers, cell markers that you have to do. So it's like a coding, like CD90, CD73. Some will be positive, some will be negative. It's the perf CD131. It's the combination of those cellular markers that tells you that it's a stem cell and not a endothelial cell, which marks basically the tissue that lines our blood vessels, or that it's not a fibroblast. So if it's negative for one of them, positive for the other, then you know it's a stem cell.
So you know you have a more youthful cell.
Yes, that's replicating in that tissue that was biopsied at that time.
So here's the interesting thing is many years ago, we thought, okay, someone looks older, let's just make them look better by trying to make their skin look more youthful. We didn't really know what we were doing, that we were functionally able to reverse some of the cellular changes with aging.
Yes.
So now we're looking at aesthetics very differently. It's not just masking a problem or putting a Band-Aid on a problem. It's actually going back to the origin of the aging to moving forward to make that cell act more youthful and to produce better looking skin, which is a concept that's happening throughout the whole body, right? Because we have longevity.
We're doing NAD infusions. You know, I mean, I think I'm a biohack junkie. I've tried it all. So I'm obsessed with it, right? I mean, I have a 2.5-year-old, so I'm trying to stay young for him. So I'll try it, you know? And I think that there's a place for all of it. But as with anything in medicine, you have to be willing to take a side effect, right? Some things sound really good, and I think that the danger has been lost in that you see something on Instagram, you get fed the benefits of it, but no one in that is giving you an informed consent and telling you about the alternatives and risks associated with it. So I'll give you an example. NAD infusions. Excellent, right? Some controversy as to whether that's the best formulation to give yourself IV, because it may not even be able to get into the cell to give it the energy that it needs. The thought behind NAD is that it would essentially support mitochondrial function, which is another hallmark of aging, and give it your cell energy to replicate and behave.
Mitochondria being the engine of the cell.
Right. And so it's its fuel, it's its power. So if you can IV infuse it, but the problem is the mitochondria resides in the cell. So you need the NAD to get into the cell. And so some argue that it doesn't even get into the cell if you do an IV infusion, which is probably the most powerful way to expose your cell to this. Others do sub-Q injections, but there's no studies to show which formulation is the best, right? And so with NAD, if it's giving cells energy to act and function younger, mitochondria gets slow with age, your ovaries are probably the ones that are getting the slowest with time, then theoretically, if you have a cancer in your body, it should also give those cells energy too. So therein lies the risk, right? First, you don't even know if it's efficacious because no one's done a head-to-head to find out what's the best form to get it. And then theoretically, let's say it works, you might be giving the wrong cells energy if you have something growing in you. And so that's why these things sound great, but you have to always remember in the context of you as an organism, a holistic being, and being monitored by a physician who's...
Yeah, it's the very early stages of
right.
longevity. And this part of medicine is growing rapidly.
Yeah.
We had a keynote speaker at our last meeting in MWC in Florida, and he's an expert in longevity. So I asked him, how long can we live to? Like, what do you think is the maximum time period we can live to? He said in his estimate, living to 120 is probably not that far away, that many people will be living to 120. Some people argue that you can live to 150, but this is the point. It's not about how long you live. It's about the quality of the life of the years that you do live.
And the quality of the skin, which we coin skin span, in that time, right? How could you look in the span that you're living?
Right. So you want to live a quality of life longer than we do now. And that is very much in reach with modern medicine. So it's an exciting time.
Right. And so just always being thoughtful that there's probably another side to whatever you're being pushed or recommended. And it's important that you still recognize that this is a practice of medicine. This is not about it's not like dyeing your hair. You get to change it back. Like if you're going to introduce something, there's a risk, there's a benefit, and you need to be aware of what those are. So
bringing it back to what we do cosmetically, how do you think in the last 1, 2, 3 years, this concept of longevity or biohacking has changed the way you practice dermatology?
I've always tried to practice a more holistic approach with my patients. I have been very sensitive probably for the last 10 years that the people that look the best aesthetically, physically, are the ones that are being optimized holistically through probably most powerfully hormones, right? But I have patients that do all kinds of things. They are biohacking through parabiosis. Some go and get like young blood injected into them in some of these foreign countries, because that's another way that you can get more youthful signaling.
Oh, that sounds so Dracula-esque.
It is. And we've seen some of these billionaires that are getting infused with their son's blood and things like this. But it's real. People are doing this, whether it's in Panama or Colombia, or they go to all places, Cabo, to do these things. And so there's a lot going on right there. So, but I always ask because I'm curious, and I never shut an idea down. I recognize there's a risk, but there's also a benefit with the things that we do. And if people are willing to take the benefit or take the risk, then that's a choice, right? Just like jumping off an airplane and going skydiving. And we're taking risks all the time. So what I do see though is those that are doing these things generally look younger. So I'm always curious, like, what are people doing? They're crossing the border. I'm 20 minutes from the border. They're going to get IV exosome infusions or injected with stem cells, doing all kinds of things, So I think people are becoming more open and sharing.
So how does this change your dermatology practice?
It makes you realize that the people that look the best aren't just doing things with me. They are doing things to hormonally optimize themselves and holistically optimize themselves. And I would probably say the most powerful thing are hormones for women. So the women that are 57, 58, that look like they haven't really aged or haven't even shifted into menopause are the ones that are, coming in regularly to see me, but they're also optimized hormonally. And, estrogen, of course, is the star of the show, but it's not just estrogen. It's progesterone, possibly DHEAS, pregnenolone. Some people need that. It's a precursor to estrogen and testosterone, or they may need testosterone. So there are other hormones that are involved. I mean, obviously you and I are leveraging oxytocin because it's estrogen's cousin, right? And has similar effects on the skin, which has been published and shown in the dermatology and plastic literature for over 20 years now. So it's leveraging those hormones because those hormones play a role on many of the different cycles or many of the different components of the aging cell. We talked about the 16 pathways. They affect many of those pathways, not just one. So
that's how your dermatology practice has changed, that you're more sensitive to making sure that women get these hormones replaced as they're aging in their skin.
And that they're not waiting until they tank, that they're not waiting until they lose their period. They just slide into menopause. They get optimized 4 to 8 years before they actually lose their period.
And what about your fillers and your laser treatments? Has that changed?
In the beginning, they just wanted fillers or injectables. They wanted the quick fix. But there's a greater awareness on skin health today, and people are definitely more amenable to lasers. We also have a lot more lasers in the last 10 years than we had 10 years ago. So I think that people are definitely incorporating, I see them incorporating more, but of course, I have the bias that I'm a dermatologist. So people come to me seeking those lasers, but I definitely recognize that people are incorporating that more into their aesthetic plan to biohack their skin.
Interesting.
Yeah.
Learn something new.
That's what I try to do for you, Ben.
Doctor's orders.
Injectables, lasers are all wonderful and will definitely on their own biohack your skin to a certain degree. For how long after a single session, we don't know yet, but definitely many of them have shown to be able to do this effectively. But how you are systemically, holistically, is always going to shine somehow. So you've got to take care of yourself. You have to sleep well. You have to eat well, not such a high inflammatory diet with super, high sugar. You got to get hormonally optimized. If you're 40 or over, I highly recommend seeing somebody to figure out what your baseline labs are. Because if you are trying to biohack your skin, those things are going to have an impact on your skin.
So is my sleeping 3 hours a night and eating pizza every day not a good idea?
I think you're going to need a lot more XOMD than
All right, if I'm going to add a doctor's order, I would say that this is a really exciting time with regenerative medicine, not just for aesthetic medicine, but also for holistic medicine. And the real possibility, it's not just pseudoscience anymore. It's not just sci-fi. That we really might be able to reverse certain signs of aging is incredible. How long, for how much, I think it's limited, but actually the science is starting to come into focus. But like everything, I think you mentioned it, I want to just reiterate it, you have to see an expert. You want to get all the risks and benefits, and there is risks still associated with this yet until we figure this out, what the best way to optimize these treatments are.
Yeah, a lot of the injectable peptides are not, FDA approved.
Right.
So they're being compounded at pharmacies. You don't know the level of sterilization practice that compounding pharmacy might employ with what they create.
Side effects could affect your blood.
It can affect your blood. It has been shown there have been reports of people dying. So it's still the practice of medicine.
Yes.
Yeah. All right.
All right. See you next time.